just turned on the recording function. About 1 minute to go. Jayatri, I'm going to turn my sound off. Okay. And I will send you a message in the chat that lets you know when you're live.
Sounds good.
Okay.
And the questions, you'll say the questions, right?
Yeah, yeah, you don't need to worry about the chat or anything.
Okay, great. So just stare at the camera.
Yep. All right, 30 seconds. Good afternoon, everybody. I'm Dr. Jayatri Das, Chief Bioscientist at the Franklin Institute. Thanks for joining me for this conversation today. You might notice that my graphic and the title of this program has changed from what used to be COVID-19 conversations to the future of health. And that's intentional because we're taking this conversation in a new direction. For the last year, we've been here bringing you all of the updates around the news breaking around COVID-19 pandemic and how we make sense of the headlines that are affecting our lives on a day-to-day basis. But now, as the United States is starting to emerge from the pandemic and starting to see some light at the end of the tunnel, we want to broaden this conversation to think about how we rebuild a future that helps support everybody be healthier. And so we'll still be back with updates on COVID-19 if there are things to report. But this is the first in a series of conversations where I hope you'll join us in thinking about how science, technology, and our communities can all work together in thinking about how to rebuild and recover and really reimagine a different future that's targeted towards health. So I'm really excited to have a guest here today who can help us start thinking about all of the different perspectives that we can bring into play. Alex Chen is an MD PhD student at the University of Pennsylvania, and I got really interested in learning about his research because he really brings together some unusual perspectives that we don't always think about when we think about health and medicine. So Alex, as we start thinking about reimagining our future, thank you for joining us. And I thought that we could start just by asking you to tell us a little bit about your background and some of the diverse expertise that you bring to the table.
Sure. First of all, thank you so much for inviting me. It's an honor to chat with you and to talk to your audience at the Franklin Institute. So a little bit about myself. I am interested in way too many different things, and which is why I'm in a 8 to 10 year PhD program studying anthropology and medicine. I am currently working on a project that looks at how we build scientific infrastructures in the context of emerging diseases. So how do we think about the sciences that's going to be carried out for 5 years down the line, 10 years down the line? How do we build these physical spaces to support that? And my work really grew out of my sort of undergraduate training in architecture. I chose to do architecture as a pre-med because I was like, this is my last chance to learn about a totally different part of the world, a different, how things function. But it's been helpful with my research because having that training in architecture helps me see a completely different side of the pandemic.
So that's a really interesting place to start because, normally we think about health and medicine as being, kind of what's going on inside the body. But you really think about how that intersects with the physical spaces around us. And you actually started thinking about this even before COVID, right? So you've written about how your interest first started developing around Ebola. Can you tell us a little bit about where your interest started and kind of where your research is going right now?
Yeah. So where this interest in Ebola started specifically was in my master's program. I was doing a master's in design studies, thinking about how do you build resilient sort of health systems. And my project was working with emergency medical technicians to, how do you prepare for this horizon of emergencies that's going to come. And at that time, it was 2014, 2016, and that was when the West African Ebola epidemic was really happening. And back then, I didn't really know what to, how to bring what I've learned to think about that, to do something about it. But my current research is basically taking that sort of initial seed of an interest and seeing what I can do with it, given the tools that I've learned, having gone through a little bit of med school, having gone through a little bit of anthropology training.
And so tell us a little bit about that intersection between the biology of a disease and then thinking about that physical space. And for those of you who are listening out there, if you have experience as an emergency technician in different emergency spheres, we'd love to hear about your experience. So go ahead and throw those in the chat.
So many different ways to count, right? I mean, every time we sort of go inside the hospital, we can feel the sort of impact that the physical space has on our experience, right? On how we are healing. And there's a lot of research and experiments that goes into how do we design healing spaces, for example. In terms of my research and thinking about building scientific labs, I think these are the places where, things like vaccine engineering, vaccine research first get their start, right? So how do we actually support these kinds of ventures? And they are not possible without the kinds of laboratory spaces that architects and engineers are building really for the future.
So take us into one of these spaces as a thought exercise for those of who are listening out there who may not have ever worked in a hospital lab or or a university lab where this kind of research is going on. Yeah. What does that mean?
Yeah, well, maybe this is a good time to sort of bring up that picture.
Sure, let me pull that up because I think this is an interesting example to talk about here. So let me go ahead and share my screen here.
So this is a diagram of, I believe this is the biocontainment clinical unit at Johns Hopkins University. And this is sort of a built from scratch facility, as far as I know, that was sort of built in response to the Ebola epidemic. So they think about, so how do we, deal with these highly contagious and highly deadly emerging diseases, right, that we are expecting to come in the future. And this was in 2017, right? So you have to put yourself back into the 2017 mindset when these things seemed remote. At most we'll have a couple of patients. Maybe they come over on a plane. Maybe we are extricating them from some exotic location. And what piqued my interest in this particular space is that you see how detailed the activities sort of are choreographed, right? So Ebola is something that is like really easily transmitted via fomites. So for the healthcare workers, the frontline healthcare workers, to protect themselves as they're treating the patients, they have to go through really rigorous training, really like learning how do you go through those complex protocols of donning and doffing personal protective equipment. How do you move through these spaces? So you see the green, yellow, and red. So red is like the sort of hot zone where the patient is. Green is like our normal sort of spaces that we live in. And the yellow is the sort of interesting liminal space, I guess, this in-between space where you have to do these sort of maneuvers to protect yourself. And I had a chance to visit one of these facilities, and back then there were only a couple of these around the country, more sort of experiments in preparing for the future. And it was difficult, right? Like, we can build these spaces and it makes sense on paper. But when you're there trying to be very intentional about the way that you're putting on these like hazmat suits, you have to put them in a particular order. If it's hard breathing in a mask, like it's 100 times harder to breathe in this like full body suit with this like, positive pressure mask helmet that you're wearing to protect yourself. I think another point that was interesting to me was how much the sort of physical aspect, these technologies, right? So conversations about ventilation, which we're very familiar with now. Conversations about, or these experiments where you like put, release powder into the air to see how things flow. You put fluorescent dyes to see how things get moved around surfaces. These were sort of being experimented and tested right back then.
And so we're seeing how that kind of work is now making its way from the healthcare field into understanding how we design all different kinds of spaces. Yeah. I've seen simulations of how doing that kind of particle dispersal experiments is like takes place on airplanes as we think about how to make airplanes safe. Right. The other thing that I thought was interesting about this, and that maybe you can speak to from an architect's point of view, is also trying to embed some of this behavior into just how things are designed. Like the fact that even the doors are red, yellow, and green. Like literally, it's not just sort of a color coding of the space, but literally, they're if there's a red door, then don't go in there.
Right.
Unless you absolutely have to, right?
Right. These notions. And I'll say that I guess I see myself as kind of like an apprentice, right? I'm doing field work with architects. I don't have a license, but I get the privilege of learning from them and how they see the world. And yes, it's so interesting how, the placement of a door is like critical to the way that this place would function, right? And I think it's interesting how like it's not, there's a lot of COVID signage, for example, wash your hands for 20 seconds, wear your mask. But a lot of our sort of everyday activity is actually patterned spatially. So, research that I read, I think it was when I was like 2012 or 2013, was like, how do you get physicians to use Purell hand sanitizers, right? And they actually put the hand sanitizer dispenser in different parts of the patient room to see which one actually promotes usage. And the best place to put it is actually like right when you exit the door, like right where at, sort of 3 feet off of the ground, because they see it immediately and they're sort of tempted to do something with that, to interact with that. You can put a bottle on a desk, and expect and tell people that, when you go in, go and do this. But it's really hard for us to move out of our habits until we design around some of those core habits. The other thing that's interesting to, I think about that my, designer interlocutors have taught me is just so many other things, right? So many other expertise is necessary to build these kinds of places. So these are also just hospitals with regular concerns about infection control, with regular concerns about traffic, with regular controls about like sprinkler heads and, fire safety, all of those things. So really to make the space activated, it's not just sort of innovation coming from medicine side, but also a lot of other different expertises coming together to make it work.
Yeah, okay, I'm going to stop sharing this now so we can go back to seeing ourselves here. But I think you raised some really good points in terms of how, we have to kind of develop new habits, to tackle new health challenges, and design and physical space is such, an important part of that. Even just thinking about, in my own house, how do I get my kids to remember to, to put their masks on before they go out the door? Right. And, we had to like put up, little temporary hooks next to the door so it's staring them in the face, right?
Exactly.
So I think, we can probably all reflect on, how these big ideas about, design and space filter down, to, spaces outside the healthcare system, as well as into our own house. I wanted to circle back, Alex, to another idea that you brought up earlier that kind of struck me in the language that you framed it as, in terms of thinking about these diseases coming in from outside, and how we, have this perception of, needing to protect ourselves to keep them out. And that struck me as really interesting too, because that really frames, how we think about our global community, in terms of where are threats coming from. And I know that's something that you thought about, from the anthropology side of your thinking. Can you talk a little bit about that?
Yeah. And I also say here that I have, colleagues and friends who have published papers on this sort of self-other relationship when it comes to the pandemic. But here, I think it's helpful to go back to thinking about Ebola as well, right? Because it was so very clearly, I mean, you would see the way that it's presented in media, the way that people sort of reflexive responses that this is sort of an exotic thing coming from elsewhere, that we need to like, shore up the country's defenses to keep these sort of pathogens out. And of course, pathogens don't just sort of diffuse across the Atlantic or the Pacific, right? It's always attached to people, and then people end up being the ones that are sort of surveillanced and kept out. And that's the kind of issue that really concerns me, because we see that now, for example, with COVID, right? The kinds of anti-Asian discourses and incidents that are happening. And these aren't sort of one-off things. These are, as you look at the history of infectious diseases, especially these emerging ones, go back to HIV, it was the 4 H's, right? Again, people who were othered and made into the sort of outcasts and emblems of these diseases. On the other hand, there's also the question so who is the us, right? If there's the other, and the problems associated with that. And the us, I feel like in my research, one, as you read through these peer-reviewed articles about preparedness, it's never specified who, right? It's this very generic, like, I guess whoever reads the paper is the us. But then you start to think about the history of racism, to pick one, in the United States, for example, and start to see that the us actually is a very particular group of people, right? Usually the most privileged in our society. If we're thinking about peer review papers, it's the people who can read the peer review papers, for example. If we think about it from an infrastructural perspective, hospitals are not designed in a way that centers the needs of the most marginalized or vulnerable communities, right? It is thinking about capital and money. So those sorts of concerns, and who do we include into this conversation to create this us, I think is also important to consider.
And that then plays into how we respond to these emergencies. How do we pull together to build that feeling of community, that we're all in this together? I don't know that anybody has the answer to that right now. I mean, we're looking at that, as you look at the, where we are in responding to COVID, you're thinking about how do we build that trust to distribute vaccines, for instance, in a way that's equitable, or in a way that that people are willing to consider, in a way that that maybe doesn't necessarily reflect what they're hearing in their immediate community, but thinking about that relationship between the health of ourselves and the health of our community. And that really strikes me as a challenge that we're facing, as we move forward. And so, as we think about what we can learn from each other, you've written about what it means to be an expert, like who gets to be an expert. And I thought you had a really interesting perspective when it comes to even just masks. Can you talk about that a little bit?
Sure. So I was born in Taiwan and immigrated to the US. So always, I'm a naturalized citizen. So I always like have, one foot in and one foot out, sort of see things from multiple perspectives. And thinking about the mass, I think partly it was driven by sort of these very early on conversations, right? If you think back to February, March, the conversation about masks is like, don't buy masks. They do not help, and people are hoarding them. We need to reserve them for our healthcare providers. And then there was a moment in April when that suddenly like flipped, right?
Yeah.
Very dramatically from masks don't work to masks work and everyone mask up. And of course there's research, right? Research takes time, but I think that's also part of the reason why, if research takes time, the ways in which we translate research into actionable guidelines also follow, I think, similar times, right? They should, in some ways, follow at the same speed. Now, I don't like guidelines, so I can't speak to the sort of
right.
urgencies of the time and all these sort of complicated factors that go into them. But what I will say was interesting seeing, given these diseases, emerging diseases are unknown. We don't know anything about them. At least we being the United States, who has at least a few weeks, a few months more experience than us, right? And especially if we think about the scientific community as one that is truly international, this sort of us versus them binary doesn't really exist or shouldn't exist to begin with. What was interesting to me was seeing sort of physicians then, the op-ed pieces that were very critical of people buying masks at the retail level, which a separate topic. But and the image that was always used was always from an Asian community. He was an Asian person wearing a mask. So the subtext
and you're just talking about just like
clear.
pictures in the media.
Yes, pictures in the media, right? Or there was a 60-minute interview that Dr. Fauci did, talking about his perception then of what mask efficacy was. So there's that part of like feeling sort of exoticized and othered, right? This was, sort of ignorant practices not done by the experts and the most knowing people at CDC and NIH, the scientists who keep us safe. But we sort of forget that there are also scientists and are their equivalent of CDC in other places, right? That's where the research is coming from. That's where the initial papers that we're reading about mask efficacy comes from outside the United States. So how do we actually start to take those things seriously as a source of knowledge, right? To sort of give that, just like we sort of want to give a sort of measure of good faith and trust in what scientists do and say. Like we don't see what they do in their labs. We expect the process of peer review and their sort of internal professional conduct to really be running smoothly and perfectly. Cannot be extended, right, to the places that we might consider marginal globally. The flip side, of course, is that, late in August, I think, there were, the public health officials thinking about, so now that we're into this pandemic, from where are we looking for inspirations, right? Who has done this before? And at least a particular example I've been thinking about with our city was that the reference was Europe. It was the UK, Germany, Spain. And so that really sets up a sort of contrast, right? Like, why this place? Why this continent and not that continent? You know,
Right.
how is this hierarchy set up in the minds of people who give their expert opinion, you know? Another way to frame this might be implicit bias. That might be a more
Sure.
technical term. But I think framing it sort of as a personal thing might not be too helpful, right? I want to say that these implicit bias might also happen at the social level. You know, this is a population level wide phenomenon. So how do we start to go back to that community, right?
Yeah.
As we think about the future, how do we address some of these implicit biases and then forge new ways of connecting and understanding and learning from each other?
Right. I think you've raised a couple of good points there. That one is that, you know, as we try and think about, you know, these global challenges that face our you know, that challenge our health, you know, it is like it is Asian countries that had experience with, you know, another coronavirus, and so maybe the next time this comes along, the question is not why masks, but why not masks until we
Right,
know better, right?
right, right.
But also recognizing that those, you know, those social biases do have very personal and individual
Mhm.
impacts, as you know, we've seen
Yeah,
in, you know, sometimes very tragic ways, but also on an everyday level.
right.
And as we think about, you know, celebrating Asian American and Pacific Islander Heritage
Mhm.
Month, like what does that mean? You know, how can we truly appreciate the global knowledge that we have to bear, you know, that comes into science. So
Yeah.
I think, you know, I think you're absolutely right that there are many levels of community at
Mhm.
which we, you know, we want to be thinking about these questions.
Right.
So if we want to broaden back out again, and this is where, you know, we just want to, you know, kind of dream
Yeah.
big, I
Right.
think. um, you know, I think you some of the questions that you talked about in terms of healthcare and healthcare facilities are interesting because it's like one example of how you can
Mhm.
bring together different fields of expertise. As we think bigger, how do we start to imagine what an alternate future could look like? How do we break out of these boundaries that sometimes, you know, kind of fence us in?
Yeah. I think it's hard, right? Like, you know, if someone just gives you a blank sheet of paper and tries to tell you to imagine a new plan. I think this is where I actually find my anthropology training, which is very long, many classes that's required, to be really helpful. And in particular, the sort of attention to history, right? Which is that even when we say these problems are emerging, you know, we make a claim that it is. We sort of erase everything that came before to make the claim that this is emerging. So what if we think of things as like, this has happened before? What kinds of archives might we actually draw upon, right? What other ways can we think about these different things so that we're not sort of reinventing the wheel, so to speak? And I feel like when we start to think about that way, then so many other sort of possibilities open up, right? I mean, there's also, I think, just to add to that, thinking about different ways of communicating to people and think of these things as more than just, you know, one-off engagements, right? Just like the work that you are doing in sort of communicating science, right? This is a long
Right.
battle or maybe battle is the wrong word. This is a long,
It's a long conversation, right?
right,
It
a
doesn't
long
start
conversation.
and end and with one.
Yes,
Yeah.
exactly. And there's multiple people that are involved, and we need to sort of broaden that conversation. Um, you know, certainly one website, you know, guideline isn't going to save us, so I should update it at midnight. um, so I do have faith in some ways that there are actually lots of interesting things that have been happening, right? So think of Facebook, for example, this like friendly neighbor epidemiologist, you know, who is then actually translating these very complicated scientific concepts not into digestible ideas, but into a medium, right? That is, people are on Facebook. I spend 3 hours on my phone every day. Take advantage of that particular opportunity, right? In terms of thinking about vaccine hesitancy, I mean, we've had vaccine issues, for a very long time. This is not new with COVID. But I'm really heartened by, especially the ways in which like Black physicians and scientists in Philadelphia have really like come together
Sure,
to, insist that this is an important thing that we need to look at, right? How do we combat vaccine hesitancy and to actually take that leadership position to use the not only personal expertise, but like community knowledge and know-how to sort of bring that to bear on sort of addressing the health disparities and social disparities that COVID sort of exacerbates. You mentioned AAPI month, and it's very interesting to sort of see myself in that. And I do think historically it's important to remember like AAPI was, it was a political statement of sorts. Like we all come from so many different places. Asia is an enormous continent. Also, many, many different islands, right? It's not just
There's
one
so much
landmass,
diversity
right?
captured
Right. So
in
much
4
diversity.
letters.
Right, exactly. And I think there's an updated version now. But I think the point there is that like if we don't come together, right, we're going to disappear on our own, as Taiwanese, as Japanese, as Indian. We have to like take other problems as our own in some ways, especially for people who can have that bandwidth, who have that ability to do so.
And I think,
And
when it comes to infectious disease, like,
yes,
that's where the rubber hits the road because,
yes,
that's,
yeah,
we're all in this together.
right,
But I think, you talked about some of the, some of the approaches that we're seeing, in terms of getting vaccines distributed. And I think one of the things that's really fascinating me is thinking about how it's turning into like a social thing, right? We're hearing about, setting up vaccine clinics at breweries where you get a free beer, right? After you get your.
No, is that a good idea?
Not that I'm,
no comment.
alcohol consumption necessarily. But thinking about, how do we integrate, again, coming back to this idea about integrating health with the physical environment is, where are people and how do we bring that to them instead of expecting them to go out of their way? Right. So, but and then in the same sense, like, when you have, one of the things that we've tried to talk about is, we see, everybody who is a member of the Franklin Institute community is then a science communicator to their own friends and family, and how, how do we each play a role in that communication? Because, I'm here, I happen to be, on Facebook in this window at this time. But maybe there's something that somebody learns from me that they can then share with a friend because I'm not there talking to their friend. And, your friend is going to trust you more than, someone they've never heard of. So it's this like social environment that we're building around health that I think kind of excites me.
Yeah, and to me, especially in thinking about, scientific expertise, I think it's important to remember like labs are embedded in society, right? Labs are not just free floating sort of entities in which these sort of knowledge just magically appear. And so what might that mean? What is a lab's responsibility to the world that they are embedded in? And here, just to go back to history a little bit, I think it's incredibly admirable to think about Dr. Fauci's like experience with HIV. He was one of the first few scientists who like listened to AIDS activists. So what might that look like now, right? If the experts sort of walked outside of labs and scientists to really think, how do we engage with community members? How do we engage with activism? So we're not just sort of stuck in, looking at this one singular thing, right? And I think there's a lot of potential there, if we are all there to sort of, if science is there for the betterment of humanity.
I think that's a perfect note to end our conversation on is, how do we think about, bringing in these different perspectives so that, science is serving our communities, that, like you say, we don't exist in isolation. It's,
Right.
it's just one of the many tools that we have. And, I think health is one of those lenses that really brings all of that into focus because it is so personal.
Yes. Okay. Yeah.
So, Alex, thank you for joining me today, and thanks to everybody else who tuned in today. We're going to be, I think, this is really just the first conversation in thinking about, all of the different perspectives that come together. Next month, I'm excited to be talking with some folks in Philadelphia who are putting forth what's called the Well City Challenge to think about how different community groups are coming together to improve health in our neighborhoods. And so I'm really excited to find out more about what's going on there, and I hope you'll join me for that as well. So if there are other ideas that you're interested in out there to thinking about, what's gonna happen in 5 years, 10 years, what's happening right now, drop us a note. Let us know what you want to hear about, and we'd love to talk about it with you. So Alex, thanks again for joining us, and look forward to seeing you on here on our next episode of Future of Health. Thank you.
Thank you.